Hello friends, Dr. Abdul Khalik here, medical gastroenterologist and CEO of Umda Healthcare. Today I will be discussing a topic of how to reduce the number of bad Google reviews given by any patients to any practitioner like me. So if we look at scientifically, there is a terminology called Haddon matrix. This is used predominantly as a tool to avoid injuries, particularly road traffic accidents or car accidents. And this matrix has three categories like pre-event things, during event things, and post-event things. And the different parameters in which they will be looking forward are the parameters of the host, the parameters of the agent, and the parameters of the environment. I've taken inspiration from the Haddon's matrix and try to use it to prevent an untoward incident, that is writing a bad Google review by any patient or their attendant. So in this, the three factors that will determine the unsatisfaction of a patient are: one are the patient or their attendant, the second one is the environment, which can be the physical environment or socio-economic environment, and the third thing is the hospital per se. And the events, as previously described, may be a pre-event or during the event or post-event. During these three phases, what are the different things that we need to consider and work on? I will be discussing about them in detail. Let us take the first parameter, that is the patient parameter. If we take the pre-events, sometimes the patient may become unsatisfied or write a bad review because of his personality, may be a person who is unsatisfied by many things. The second thing can be his mood at that point of time when he came for a consultation or during hospitalization. His or his patient's attendant's mood may not be a very pliable or a very good mood. These two factors can lead to an unsatisfactory patient or his attendant and a bad review. Or during the event, sometimes commonly it is seen that the patient's expectations may not be reached, like the importance that he expects from the staff, or the time that he requires from the doctor, or a proper counseling that he expects from the doctor or this team may not be reached. Or other thing is, which we commonly see, is his bill may be out of what he might have expected. So these are a few factors from a patient's or his attendant point of view which can lead to unsatisfaction. And during event, generally what they do is they sometimes speak in a high tone or even shout, or sometimes manhandle the staff or even the doctor, or sometimes cause the physical damage of the structure of the hospital or something. And one more event is sometimes they go back and they write a bad review about the doctor and the hospital in different social media platforms like Google or anything. So these are the different parameters that we need to consider, brainstorm ourselves, and see how we can reduce them. Coming to the environment, the physical structure of the hospital which facilitates the consultation and IPD has to be designed and so that it makes conducive for the patients to come and have a pleasantful experience to sail through their consultation as well as during hospitalization. For example, if there is a difficulty for parking the vehicles, or if the valet parking is not available, or the security person are not allowing the patient or the attendants to come in, or say the orthopedics department is on a different floor because the patients may not be able to come to second floor or third floor, it's always advisable for such type of departments or a geriatric department to be present on the ground floor. Adequate number of stretchers, adequate number of wheelchairs, adequate number of staff to guide them. These are all the physical environmental things which are expected to meet with the norms of the the industry. Sometimes even the seats that we provide to the patients while waiting, if they are tough, inadequate ventilation is there, inadequate temperature maintenance is there, or if drinking water facilities are not available, or tidiness of the environment is not being kept, the bathrooms in particularly if they are not clean, all these environmental factors may lead to dissatisfaction of the patient or their attendants. In the same way, the socio-economic environmental factors, predominantly we see there is unsatisfaction among the patient or attendants regarding the billing, or the costing, or the waiting time, or sometimes there may be a lack of communication about what actually the bill is and how much they need to pay, or there may be a lack of communication between the status of the patient and what are the investigations that are being done and what is his progress in the improvement of the patient. So all these things may lead to unsatisfaction of the patient and going ahead with untoward event like writing a bad review of the hospital or the patient. And coming to the most important parameter that is within our hands is the hospital or clinic or doctors. As doctors, what are the things that we need to take care in the pre-event and event and post-event? In the pre-event, as I discussed, the different parameters of the hospital or the clinic that needs to be kept in the mind and has to be designed or altered accordingly. In the same way, it's always better that the hospital buildings, the hospital norms are more or less matched with the norms of other hospitals or the clinics that are present in the same city or the town. Neither the bills or the cost should be exuberant, nor the services should be subordinate. In the same way, there should be matching to the expectations of the patients. For example, in the website or in the different social media accounts, if we are saying as if this hospital is A grade and showing all rosy pictures, but we are not fulfilling the promise and we are not able to deliver what we have committed within our websites or within our different social media accounts, then there will be a discrepancy of what we actually said and promised to the patients and what we actually deliver. That can lead to their dissatisfaction. So always commit and write in the websites the things which we are able to provide. Do not boast ourselves in the websites of the things which we are not able to deliver. Second and most important thing is always the dissatisfaction rather than the environmental factors is commonly seen because of the human factors, particularly the type of the staff that we hire and we employ in our clinics and hospitals. There should be a few important parameters that we need to see, that they should be charming and smiling, and they should be sensible, they should be responsive, and they should communicate with the patient and their attendants regarding the availability of the doctors or the waiting time or the expectation of the billing. So they should be more proactive and should be engaged in the conversation with the patients while they are waiting or their attendants to avoid such untoward incidents. During event, what the hospitals should do. Say some patient or attendants becomes unsatisfied in some event, say in an OPD or for the waiting for an OPD for their turn. They may speak at a high tone or they may even shout. At that time, the staff should be well trained how to tackle such situations. They should try to speak to the patient or attendants and try to pacify them. If they're not able to pacify, they should try to take them to other room, make them comfortable, sit, give them some water, call some superior and make them understand the situation, why they are not being attended. And they require some amount of pampering, which may satisfy their ego, and they generally calm down and they fall in line. These are the things that we need to train our staff so that whenever such untoward incidents happens, they become proactive and they do all these steps in this manner. For example, if we identify these things in a post event, that the patient went back, and after going back, he has created some review. So always we can identify by speaking to the doctor and the staff that who may be the patient who had written such a review. We can communicate with him either personally in the phone or through email, try to understand his concerns, address them, and try to ask him to remove the review. If we are not able to remove, and if we think that the review was unjustly, then we can flag it and we can request the other patients who were satisfied by us to give a positive review about us. Or sometimes even we can go ahead and if we are genuine, we can go ahead and we can respond him appropriately to that patient by saying that this is what the situation was, this is what we try to understand, try to do to you, and we need to be humble and gentle while writing these messages, particularly in any social media or within the Google reviews. And sometimes in an IPD, to avoid such type of post-event untoward incidents, particularly if a patient's death happens, it's always better to settle their bills as early as possible and to allow the smooth passage of the patient's body without causing a lot of discomfort for the patients. By avoiding such type of things, untoward incidents of patients becoming unsatisfied, writing bad reviews, or making nuisance in the hospitals, or destroying the properties, or manhandling the staff, will come down. So as hospital owners and owners of the clinics, this becomes our an important tool, the Haddon's matrix, to look into different parameters, and let us be proactive and try to discuss with our staff what are the things that may go wrong, and train them in different situations how they should respond, so that by doing these steps, the chances of untoward events will come down. If you want a one-page summary of what I said, of the table of events, their pre-events and the post-events of patients factor, environmental factors, socio-economic factors, and hospital factors, you please leave a message, okay, I want a single-page PDF on the given number. We will WhatsApp you the single-page PDF so that you can apply in your hospital. Thank you.